Hey folks, good to have everybody today. We've moved this up a little bit because I have a special guest with Dr. Anthony Fauci, who will be joining us momentarily from Washington, D.C. I really appreciate everybody joining today. We went over some things last week when I did this from Washington, and we may repeat a couple of those things as we wait on Dr. Fauci. But let's talk about where we are as a state right now with regard to the COVID crisis, because we are still in very dangerous territory, folks. Alabama is unfortunately one of those states where the cases are still rising and rising fast. I think you'll hear from Dr. Fauci later that as a country we are still in the middle of this first wave, not a second surge or a second wave. During the past few days, coronavirus hospitalizations in Alabama have reached their highest levels since tracking began, with 1,016 people currently hospitalized. Notice there that 27% of those people, of all people that have been infected, have been hospitalized. That's an extraordinary rate. And I bring this out because of more recent comments that we have heard that 99% of people, it just is not a problem. Well, that is not the case. When 27% of the people in Alabama have to be hospitalized because of this virus, and the statistics will show now that we have seen 45,263 cases. 45,000. And out of those 45,000, 27% have had to have been hospitalized. Do the math. That is a serious, serious virus. We now have in our state over 1,016 to be precise, of our friends and our neighbors and our family members who have lost their life to this deadly virus. That is unacceptable. What is more striking is that about 30% of Alabama's cases have come in the last 2 weeks. Now I want that to sink in a little bit. 30% of those 45,000 plus cases have come in the last 2 weeks. Come since Memorial Day, after we loosened restrictions and after people started ignoring the signs about wearing a mask and social distancing. Now we are in a position, as opposed to where we thought we would be in April and even in May, where our numbers were going down as we were going into the summer and into the school year in August. Our numbers are still extraordinarily high, and we just finished the 4th of July weekend. The numbers from this weekend haven't come in yet. I don't know, I've seen the photographs that were similar to Memorial Day. We will see what happens later in the month of July and in August as we move to open our schools back up. 4 of our largest cities in Alabama, 4 of the 5 largest cities, Birmingham, Mobile, Montgomery, and Tuscaloosa, have all passed ordinances. And now Huntsville and Madison County have passed an ordinance and an order requiring masks in public places, as in different ways, but requiring the use of masks. So in Huntsville, Mayor Battle recently said that Huntsville has tripled cases, and hospitalizations are up 660% in Madison County. Huntsville Hospital is postponing inpatient elective procedures as a result in the rise in cases. So as we see where things are going in Alabama, I've said it before and I'll say it again, this is something that we have to take a special note of, and it is personal responsibility, not only in Alabama but across the country. If we could go to slide number 2 real quick. We talk about how we are doing in the United States. And if you look at this slide, this shows the trend lines of all the countries across the world. And you look at the trend line for the United States, and it is some of the worst. Only Brazil has done worse than we have. And today it was announced that Brazil's president has been tested positive. The United States has not done a good job. We were on a downhill slope, and now we are back up. Let's go to slide number 3. We talked about this a moment ago. In slide number 3, 7.3% of all Alabama COVID patients have been hospitalized. 20% of those are currently hospitalized. So I misspoke a few minutes ago. 7.3% of Alabama patients have been hospitalized. That's still a far cry from the 99% who are supposedly having no problem. When 7.3% of our cases have to be put into the hospital, that's a real problem. 27% of those folks are now currently hospitalized. Hopefully we will see a better therapeutics as we go forward. I think we're doing so much better in that. Let's go, and you had this up just a second ago, let's go to slide 4, because I think it's important to understand as we go forward, this is not just a question of more testing, folks. This is community spread. This is not just because we have more tests in the state of Alabama or across the country. We're seeing a rise in the percentage of cases that we're seeing test positive. Percentage as of the number of tests have gone up to 10 or 11% as a percentage of the total tests given. That means we've got community spread. If our percentages of the tests are going up, it doesn't really say that we're getting more cases just because we're doing more testing. It is in the community. And if you look at this slide, per 100,000 Alabamians, some of our poorest counties, Perry County, 2,006 people per 100,000. Dallas County, 2,395. Bullock County, 3,653. Marshall County has seen 1,781. Conecuh County, 1,740, and Montgomery, 1,836. Those are folks in many areas that do not have access to good health care, do not have and have seen the inequities in our health care system. So we've got a long way to go in this, and I hope in a few moments Dr. Fauci will talk to us a little bit more about what is going on in the state and around the country and what we can do to better prepare ourselves to stop this virus, get our schools open. Everyone understands we need to not only open our economy, but to open our schools. So I want to talk a minute. We've seen some movement this week from Senator McConnell. You have heard me complain for a month or more now, since May 4th when we went back, that Senator McConnell has said that we were not going to be taking up any COVID package, the next one after the CARES package that was passed. Over a month now after the House of Representatives passed the HEROES Act, we're now seeing Senator McConnell saying that he is going to have a package of COVID-related legislation for us to consider before we go out of session in August, sometime this month. Now, the problem I've got with that is that the House has a package that has been written that is not a perfect package, but does include a lot of things that provide a great framework for health and for health care, for state and local governments, for postal services, you name it. There's a lot of things in that bill. Extensions to try to get people benefits that they deserve if they're still unemployed. That doesn't mean a full-blown unemployment compensation, but things that will allow businesses to open safely and keep people engaged in their businesses, keep people with their benefits. But Senator McConnell has said that he wants to write this bill himself. So we don't have any idea what it's going to look like as it comes out of this. We have no earthly idea at this point. He is going to do that behind his closed doors, as he has done with numerous things in the past. I'm hoping, again, that once we see this package, that we can discuss it and we can include the Paycheck Security Program that I have with Senator Warner and Sanders and Blumenthal. I'm hoping that we can give states the opportunity to expand Medicaid, incentivize Medicaid. You have seen now that another state, another red state, has opted to expand Medicaid. Oklahoma voters passed that last week. So they are now another state. We're down to, I think, 13 states that have not expanded Medicaid. We've got to do that. We've got to make sure that we do that somehow, some way, and I'm hoping in this next package we can do this. Now, when we go back, we're also going to be not just working on the next COVID package, we will be working on the NDAA, the National Defense Authorization Act. When we return, as you know, it passed the Senate Armed Services Committee by a 25-2 margin. It contains a lot of really good benefits for the state of Alabama. It helps modernize our military to keep this country safe, to keep us ahead of our adversaries like Russia and China, North Korea, Iran. but it also does things for families, pay increases, better benefits, educational opportunities for families of service members. We've got to take care of our military. So that's coming up. Look for that debate to start when we get back. There will be several amendments I know that will be offered, but I expect at the end of the day that it will pass in a bipartisan way in whatever form it ultimately ends up. The managers have got it. We're going to debate a few amendments, but I think there will only be a few, and it will pass the Senate in a very bipartisan manner. The House should be passing their version, and it will go to conference as it has done in the past to iron out those differences. I'd love to see it pass before the election in November, but the odds are all of our appropriations and our NDAA are likely to be held until after that time. So as we're waiting now for Dr. Fauci, let me go ahead and he should be here momentarily. Let me go ahead and take a couple of the questions that have been submitted by the media so that when we get to Dr. Fauci, we can really spend time with him and let him answer your questions. So, Bo, if we've got a few questions that we could do in the meantime.
Gabriel Tynes with the Lanyap. According to data released by the Small Business Administration yesterday, businesses owned by members of Congress, the President, foreign companies, and large chains received loans under the PPP program. In Alabama, an aerospace firm owned by the Chinese government is among the recipients, and dozens of companies reported no jobs retained in their applications. Senator Jones, do you believe the PPP has been adequately administered? Do you support additional money for the program, and is there recourse for the program's abuse?
Yes. So here's the question. Let's just frame it appropriately. The question was, has it been adequately administered? Yes. Has it been perfectly administered? Absolutely not. Remember, this program was designed to keep people afloat, to keep businesses afloat, to keep people on the payroll. And by and large, it has done just that. There's 660,000 folks in Alabama that have benefited from the payroll protection program. So we see that it's been very, very good, but there have been abuses. We now have an inspector general in place to try to ferret those out, to try to see where we can go back. If we need to get money back, then I think we're going to have to do that. Overall, I think it's been a success. I think one of the keys for us is what do we do going forward? As we have now seen, this is opening up the economy is taking a lot longer than what we thought. As I think you'll probably hear a little bit from Dr. Fauci, sometimes we opened up a little too quickly and we jumped over the guidepost that the CDC has recommended. And now some of these states are having to pull back. And we'll see how that goes. But I think the payroll protection program, we're going to have to continue to see how that works. But we're going to look at it and we're going to tweak it because certainly there have been abuses and we need to ferret those out, investigate them. If fraud was committed, they need to be prosecuted. But at a very minimum, if the people got it when they didn't design, it wasn't designed to help them, then we need to get that money back one way or another. So thank you for that question. I see now on my screen that we have been joined by Dr. Anthony Fauci. I want to thank Dr. Fauci so much for being with us today. He has now become someone I think everybody in America recognizes, is one of the most respected faces of the administration's coronavirus task force. He needs no introduction, but I will say that he has been the director of the National Institute of Allergy and Infectious Diseases since 1984, has worked with numerous presidents, has researched to prevent, diagnose, and treat infectious diseases such as HIV, AIDS, respiratory infections, and a multitude of problems. He has been someone that I think members of Congress have consistently looked to for straight information, for adequate medical professional information. I know that we have relied on him in the Help Committee. I have relied on him, and you know that I have quoted him often. So it's a real honor to have him with us today for a few minutes. Dr. Fauci, I'm going to turn it over to you for some opening remarks, and then I got some media folks here that are just itching to ask you a few questions. So thank you so much, sir, for joining us.
Thank you, Senator, for having me. I really appreciate you giving me the opportunity to be with you today. I'll make my remarks very brief because I heard the very nice and complete introduction that you have just given about some of the issues that you're facing where you are as well as the rest of the country. So the issue is that we're facing a serious problem now because as was shown in one of the graphs that the senator mentioned. When you look at what's happened in other parts of the world, where there was a peak of infection and then a return back down to baseline, unfortunately for us in the United States, being a large country, a heterogeneous country with different levels of outbreak throughout different regions, states, cities, counties, we have peaked at a high level and stayed at about 20,000 cases per day for months until just recently, about a couple of weeks ago, when we tried to start opening in certain of the states. And as the senator said very appropriately, sometimes a bit too soon, sometimes jumping over some of the checkpoints. We now have a resurgence where we've gone up as high as 57,000 cases, which is almost double what it was at our so-called high baseline. So we have a situation right now that we've got to proceed to continue to try and open, but in a safe, measured, very prudent manner. And I'm sure there are going to be a lot of questions about that, because I don't think it should be all or none. Either shut down completely or throw caution to the wind. If we're going to open up safely for the economy and for employment, we need to do it in a way that's well thought out and cautious, but nonetheless continue to proceed. So, Senator, rather than just keep talking, let me stop there, because I know there are a lot of good questions that the press would like to ask.
Thank you, Dr. Fauci. If you don't mind, I'm going to take the liberty, the senatorial privilege of asking the first one, because last week in our hearing in front of the Health Committee, you had an interesting dialogue with Senator Paul. And Senator Paul's point was we got schools that are coming up and opening. And he has quoted some statistics that indicated that children are not as likely to transmit the virus as others. And I know that in Alabama, a concern about schools and school safety, and not only the children, but also their teachers and their families, are of paramount importance. We're looking at schools opening up starting in early August and certainly by mid-August. Can you talk a little bit about the guidelines and what folks should expect as we get schools open, and what precautions that you would urge the school systems to take?
Yes, Senator, thank you for that question. It's really a critical question. We get asked all the time. First of all, I think it's important as a fundamental principle within the reasonable guidelines of safety and concern for the health of the children and their families. Nonetheless, we should try as best as possible to get the children back to school and the schools open, for the simple reason that the secondary unintended consequences of having children not being able to go to school has ripple effects for the family that might have deleterious effects that really override the so-called safety benefits. So you don't want to be risking the health of the children or their families, but you've got to follow the guidelines depending upon the level and the penetrance of infection in the community. There will be some counties where the infection is so low, you won't have to worry. You could open the schools with very little additional type precautions other than the usual public health. In the other situation, you might have counties or parts of the state in which there is enough viral activity that you might want to modify scheduling. Things like masks at all time, things like alternating morning, afternoon, decreasing the size and the space between desks. These are things that school principals and superintendents are thinking about in a creative way. The bottom line, Senator, is that it's not going to be a one-size-fits-all. It's going to be what the level of penetrance is of the infection in any given community.
All right, thank you for that. And I want to just emphasize to folks as well that it is also that parents and families are going to also have to rely on these school systems and work with these school systems. Let them, if they impose things that you're not particularly crazy about, you need to go ahead and work with these school systems to keep these kids and yourself healthy. I think that is a very, very important for all our parents out there, grandparents, whoever has children that are going to go to these schools, to understand whatever is being imposed for the safety and well-being of the children, the faculty, and the community. So please, please participate with whatever conditions that are the school systems in their best judgment believe should be imposed. So thank you. And with that, Bo, let's ask our first question from the media.
Eddie Burkhalter, Alabama political reporter. The percent of tests that are positive remain high in Alabama, and we continue to see record highs in hospitalizations and new cases. Yet Governor Kay Ivey hasn't instituted any new restrictions. In your opinion, what would you like to see the governors in states with increasing coronavirus cases do?
Well, that's a good question, and we have some pretty standard answers for that. When you look at what we can do that we know works, it's the use of masks and physical distance and avoiding crowds. And I think to the extent in which this would be acceptable in the community, I am strongly in favor of mandating things. I don't like to be, authoritarian from the federal government, but at the local level, if governors and others essentially mandate the use of masks when you have an outbreak, I think that would be very important. Also, bars. We know that bars, particularly bars that are indoor, some bars are outdoor, but most of them are indoor. When you are indoor in a bar, in the crowded situation in a bar, that's a perfect setup for the spread of infection. So simple things, fundamental things like masking, distancing, washing hands, closing bars. If you do that, I think it'll be a giant step towards interfering with the spread in your community.
Let me follow up on something, Dr. Fauci, that I just saw recently in the last couple of days that I'd like for you to maybe comment on. There is some discussion from the WHO, the World Health Organization, that the virus, these particles may linger in the air a little bit longer than first thought. I don't think that science is completely up to date on that right now, but have you seen that, and could you comment a little bit about that?
Yes. It's referred to as aerosolized, or sometimes referred to as airborne, which means as opposed to a respiratory droplet, if I cough or sneeze or even speak, you can get thin droplets that go out for a certain number of feet, usually 3 or 4 feet, and then they go to the ground. And that's the reason why we talk about the 6-foot distance. When you talk about aerosol or airborne, there have been demonstrations of viruses that can actually stay in the air for much longer and hence get caught up in the circulation system of a given room. There isn't a lot of definitive evidence about what the impact of the aerosolization is on COVID expression. However, we have some good examples back with SARS, which is a similar virus, where there were clear-cut examples of spread by aerosol. So although we don't think it's a major issue of spread, it's something that we can't completely rule out, which is a reason, Senator, why we insist that people wear masks, because that will protect you against that.
Okay, Bo.
The next question comes from Ed Howell, Daily Mountain Eagle. What is the best type of mask that the general public can get? The blue disposable surgical mask, the washable cloth mask you see advertised online, or the homemade ones?
Well, actually, any covering for sure is better than no covering. The best one is the one you don't want to use, because it really should be saved for the healthcare worker, and that's the N95. But the surgical masks that we have, the plain old cotton ones, the paper ones, they work fine. The cloth masks we found also work in many respects as good as that. If you can home make a cloth mask that really is the same as you see with the ones that are made by companies, they're fine. I wear a cloth mask. Some of you may have seen at the hearing that I was at, I wore a cloth mask that said my favorite team, the Washington National Baseball Team, but that was a cloth mask. So you're okay with that.
Okay.
Brian Lyman, Montgomery Advertiser. Individual city and county governments in Alabama have adopted mask ordinances, but Alabama's government through Monday evening had avoided a statewide order. Can individual governments' mask orders be effective in the absence of a statewide mandate, and why or why not?
Yeah, no, they could be. I mean, I think, as I mentioned just a moment ago, individual mandates, wherever they come from, I think are important, because when people get a signal that you may or may not want to wear a mask, which means it may or may not be helpful, that's a very confusing signal. This I have here is a cloth mask that clearly would protect me. So if you say it doesn't matter whether you put it on or take it off, you're giving a wrong mixed signal. The signal should be wear a mask, period.
I want to just follow up on that too. And it's something that the members of the media have heard me say over and over. And that is an appeal to our state leaders, our local leaders, our business leaders, our community leaders. Set the example. You be the examples, because when people see you with a mask out in public, they will follow that. They will look and see. And so please, please listen to what Dr. Fauci has said. Help us set the example, regardless of whether there is a mask ordinance in your locality. You still are a leader in that community, and you should be setting the examples. Bo?
Glenn Wilson, New American Journal, asks, what is the latest thinking on how COVID-19 is most commonly being spread?
Yeah. Good question, simple question, important question. It's certainly not commonly. It is spread by the respiratory route. When people are close to each other, and I think what we need to emphasize today is something that we have to say over and over again. You should not think that the only way that you can get the infection is if someone coughs on you or sneezes on you. That's not necessarily the case. That certainly is one way in which it is transmitted. But another way is about 20 to 40% of the people who are infected have no symptoms at all. So you may be standing next to someone, and this is the reason, as the senator just said about masks, you could be standing next to someone who looks and feels perfectly well, who is infected, who is not coughing and not sneezing, but merely speaking to you. Because we now know from experiments using laser lights and various refractions, where when people merely speak, you can see very small micro droplets go out. So if you're within 6 feet of someone who is infected, even though they're without symptoms, there is a possibility that that person can transmit it to you or you to another person.
Dr. Fauci, let me follow up with something that I think is important for folks to recognize as well, and that is some of the statistics that I was reading and seeing this morning was that the median age for folks that are testing positive has dropped by about 15 years in the last month or so, and we're seeing more and more younger folks, at least younger as compared to me and you, they're a lot younger. And that is something that I think folks early on were taking for granted, that this was a virus that was a senior citizens virus, that if a young person gets it, they're not going to have any real problems or symptoms. But could you comment on how this affects young folks and what we're seeing today, and also maybe on the unknown, that this virus is still young and we just don't know the long-term effects that it might have on even a healthy 30-year-old?
You're right on the money on that, Senator, and that's a very important issue. You are absolutely correct. The mean age of people getting infected today, particularly in the states that we mentioned, is a decade and a half younger. You're absolutely correct, than what we saw months ago. The issue of young people getting infected has two aspects of it that we need to emphasize. A, it is true that in general, on the average, young people do not have as serious consequences of getting infected as elderly people and people with underlying conditions, regardless of what your age is. Because if you're a young person with an underlying condition, diabetes, obesity, heart disease, hypertension, you're as risky as someone who is the elderly. Having said that, even though the incidence is less of serious complications, we are now getting multiple examples of young people who are getting sick, getting hospitalized, and some of them even requiring intensive care. The death rate is lower, I admit that, because people in general who are young are healthier. But that doesn't mean that you could not get seriously ill. Point number two, which is also important, even if you do not get any symptoms and you do perfectly well, by getting infected, by allowing yourself to get infected because of risky behavior, you are part of the propagation of the outbreak. So you are part of the problem, because you could, even though you feel fine, you could inadvertently and innocently infect someone else, who then inadvertently and innocently affects someone who's really vulnerable. An elderly person, a woman who's getting chemotherapy for breast cancer, a young child with leukemia, any of those people, even though you didn't know it when you got infected, even though you're perfectly innocent, that you meant no harm, by getting infected, you're propagating this pandemic. So look at it at two ways. One, danger for yourself, and the responsibility to society.
Thank you. Bo?
Brad Gunther, NBC 15 in Mobile. While the number of cases is rising, the mortality rate is on the decline. Is this a function of better treatment options, the primary age group shifting to a younger, healthier population segment, and/or a mutating virus?
The top two, but not necessarily the third one. So yes, the age group, as the governor and I, as the senator and I just mentioned, is about 15 years younger. So the younger you are, the better you do, and the less likely you're going to get seriously ill and die. Number two, we definitely are better now at treating individuals, particularly because we have a couple of therapies that work well in people with advanced disease. The idea that the virus is mutating and so less damaging to people has not yet been proven at all. So I don't think you can rely on the third one, but the first two options that you mentioned are entirely correct.
And let me follow up with something very quickly that I want to emphasize, and you guys have heard me emphasize this before, especially to folks in the media. I think we do a disservice sometimes by focusing on the total amount of deaths, because we've seen a rise, and that's a problem for sure. But as the percentage of deaths may come down, that does not mean that this virus is not still very, very serious, that disrupts education, disrupts businesses, disrupts lives, because it still is. It still will be deadly. But I don't want to get into a situation where we just come to accept a lower number of deaths as if this is the new normal. We've still got to do everything we can to get this virus snuffed out. We've still got a ways to go on vaccines, and I'm sure Dr. Fauci may answer a question about that in a moment. But we've got a ways to go to get this economy back up, and we got to do it safely. So just because deaths as a percentage of total cases may be coming down, it's no reason at all to kind of let our foot off the gas when it comes to our social distancing, wearing masks, and trying to control this virus. Bo?
Kim Chandler of the Associated Press asked, how soon after exposure will a test determine if someone has gotten infected?
Yeah, the test will probably be a positive in a couple of days. The incubation period to getting symptoms is about 4.5 to 5 days. The test, which is positive before you even get symptoms often, is called pre-symptomatic capability of transmission, is probably a couple of days. I want to emphasize, just because it's such important, what the senator just said, that it's a false narrative to take comfort in a lower rate of death. There's so many other things that are very dangerous and bad about this virus. Don't get yourself into false complacency. But answer to your question is a couple of days before it's positive.
Let me, speaking of tests, Dr. Fauci, I know that this is not particularly your area, but you work so closely with Dr. Redfield and Dr. Hahn with regard to tests. And there are reports now that testing is still a little bit of an issue around the states. I know we're doing our best to get more tests out there, to get more rapid tests. I had some communications with a couple of our hospitals around this week who are still struggling to get as many tests as they really need. Can you give us an update on where you think the testing capabilities in the country are and where you see them heading as we go into the school year?
Yes, Senator, we certainly are doing much, much better than we were during the problematic early months of this pandemic. But even though the numbers look good, and this is the thing that is a little bit concerning, you say, well, we now have 37 million tests have been performed. The question is, when you get on the phone and talk to the people in the community, there are still lapses there where the dots are not being connected. So even though we've come a very long way and we're doing much, much better and we'll continue to do better, we still are not at the level that we would like to be.
Dennis Pillion, AL.com, asks, how does the COVID surge in Alabama compare to other states?
Well, you know, if you look at the curve that I just had in front of me, it's still going up in the sense of being rather steep. The baseline that you were at was much lower than many of the other states. But what's alarming is the slope of the curve. When you see a slope that goes up like that, you've got to be careful that you don't get into what's called an exponential phase, where every day it can even double or more. You're not there yet, so you have an opportunity, a window to get your arms around this and to prevent it from getting worse. It's not to the point where it's out of hand and, you know, very, very difficult to control. So you have a window of opportunity here that as a state, you should take advantage of that window of opportunity.
Morgan Hightower, WBRC, Fox 6, Birmingham. Considering how contagious and potentially deadly COVID-19 is, when a vaccine becomes available, are you going to suggest it's mandated for Americans to get?
You know, I don't think we've ever had a situation where you mandate it for the general population. So let me give you some example of mandating. So I'm a physician. I see patients in my hospital right literally out the window here across the hall at the NIH Clinical Center. During the flu season, the administration of the hospital mandates that I have to get a flu vaccine. Otherwise, I won't be able to see patients the way I usually do. That has not happened ever, to my knowledge, at a national level or even at a state level. So I could see individual institutions mandating a vaccine. I don't see it on a national level, merely because of all the situations you have upon encroaching upon persons' freedom to make their own choice of their own health.
Mary Scott Hodgins, WBHM, Birmingham. What are your thoughts on the politicalization of health information and wearing masks? What's the impact of this?
Well, I think any politicization of anything that's a public health matter has negative consequences. And that's the reason why we try as best as we can to not let political issues get involved. I mean, obviously today, it's no secret to anybody who lives in the United States that we have a great deal of polarization in our country. Unfortunately, we hope that changes, but there's no place for that when you're making public health recommendations, analysis of data, or any policies that are made. That will always be to our detriment to do that.
Lauren Walsh, ABC 3340, Birmingham. With mask orders in effect across our area, some people are wearing their mask but only covering their mouth and not their nose. What are the dangers of only covering your mouth? Well,
you've taken away 50% of your protection. So because The mask is for both inhaling through the nose and the mouth. If you cover your mouth and not your nose, you're leaving open a vulnerable part. And that's the reason why, if you have the opportunity, they even recommend in situations in which you have a lot of activity that you even wear eye guards, or goggles to prevent it. But to wear a mask like this, I mean, it just, half of it's out. So you shouldn't do that.
Lisa Crane, WVTM Birmingham. What data do you have that illustrates states with more stringent orders to stay at home and keep businesses closed are seeing lower infection rates than those states that aren't as stringent?
Well, the data are overwhelming, not only with individual states, but individual countries. And you see what happens when you see the curve go up. You do stay-at-home orders, it comes right back down. The curve that the senator showed in the beginning of the discussion before I got here, but I was listening in on what he was saying, was that when you look at what happened in Europe, it went way up and they shut down. About 95% of the country shut down. The United States, even though a lot shut down, it was only about 50% of complete shutdown. So our curve went up, started to come down, then it plateaued at around 20,000. That tells you that if you shut down and you stay at home, you will bring it down. If you do not do that, you will either not bring it down at all or you won't bring it down completely, which is actually what happened in the United States.
And for the media, I would say if anyone hasn't seen that graphic before and you need it, please contact our communications office and we will get that to you that you can use.
Jennifer Horton, WSFA Montgomery. Could you both discuss your perspective on the current funding model for drug development, specifically public funds that are used to develop medications that are sold commercially? Is this a functional model for the government and taxpayers?
Well, the federal government, particularly our Congress, of which your senator is certainly an important member, have been extraordinarily generous in the funding of the National Institutes of Health and the CDC and other agency involved in the response to this pandemic. And much of that has gone into the development of vaccines and therapeutics. So I think you can rest assured, I'm sure you can rest assured that the government, led by the Congress with the administration signing off on it, has been very generous to us in the development of therapeutics as well as vaccines. And quite frankly, we already have now 2 therapeutics, remdesivir and dexamethasone, which have shown to be quite effective in people with advanced disease. What we need more of are drugs, and we're doing clinical trials with this, monoclonal antibodies, passive transfer serum, given to people who are early in the course of their disease.
Great. I know Dr. Fauci has a hard stop in a moment. Bo, let's get maybe one more question, and then we'll wrap this up for Dr. Fauci's benefit.
Okay. This one is actually, hold on. Let's go with Eddie Burkhalter, Alabama political reporter. Many people in Alabama, as in many states, aren't wearing masks while in public, yet we know many people infected are asymptomatic. Can you speak to the importance of wearing masks, and do you think a statewide mask order is a good way to encourage practice?
Okay, I do believe a statewide mask order is important because there is a variability in people taking seriously or even understanding the benefit of masks. In direct answer to the first part of your question, masks make a difference. It is one of the primary fundamental tools that we have, particularly as you mentioned in the question, because a considerable number of individuals, up to 40%, do not have any symptoms, and yet they still can transmit the infection. And for that reason, we should all be wearing masks when we're out in public, particularly when we can't negotiate the distance between ourselves and others in public.
So with that, folks, Dr. Fauci, thank you so much for being here with us today and giving us the benefit of your expertise and your time. I know the demands on your time right now are absolutely extraordinary. I don't see how you do it sometimes, but you are always there, always available. And I also want to thank you for all that you have provided to Congress, because I was reviewing my notes recently from some of the early conversations that we had in January about this virus. And you and Dr. Redfield and others were there, provide us the early warning signs about what was going on. So thank you so much again for being with us today. We really appreciate it. Keep doing what you're doing. We need you, and we need your voices out there. And to all the media, thank you. Thank you, Dr. Fauci. And to all the media, thank you for joining us today. We really appreciate it. I want to end with this note. And remember this, Alabama now has over 1,000 deaths, but more importantly, in the last 7 days, our 7-day average has quadrupled just in the last few days. Quadrupled, folks. We got to be careful. Social distance, wear your mask, be safe. Thank you all.